Nice to see you. One of my
Oh.
longtime actors, so she's just wonderful. So. Does somebody want to time me? So I've had my 5 minutes to look at my case. I've used my common sense guide. And you will be timed and videotaped. So
Do you get like a time warning?
you get a 5-minute warning that you're, after 15 minutes they knock on the door and say 5 minutes. So when it gets, if I take too long, will someone give me a 5-minute warning?
Yeah.
Okay. Okay, you ready?
Yes.
Are you ready? Okay. Knock, knock, knock. Come in. Hi, how are you?
I'm okay. Feel better.
Better. My name's Amanda Thurman. I'm a nurse practitioner. I'll be seeing you today. I'm gonna, there's no sink in the room, but there is hand gel, so you have to hand gel your hands. Okay. I'll be doing your visit today, Jerry. What's your name? Jerry. I already know her name is better. Okay, Jerry. I'll be doing your visit today. I'm going to start by asking you a series of questions, and then I'm going to do an exam. So if at any point the exam becomes uncomfortable, you let me know, okay?
Okay.
Okay. So what are you here for today?
I just have a really bad sore throat and I'm kind of not able to handle it much longer.
Okay, okay. Can you tell me when this started?
About 3 days ago.
And what does it feel like?
I don't know, it's like scratchy, achy.
Scratchy and achy?
Yeah.
Okay. Is it hurt to swallow or hurts to swallow? Okay. Have you had anything like this before?
Not this bad, no.
No. Is this on a scale of 1 to 10 for your sore throat? What would you say it is?
Maybe a 7.
Oh, 7. Okay. Have you looked in your throat? Have you seen anything on your tonsils?
I tried.
Uh-huh.
I mean, it's kind of hard to see, but I didn't notice anything, no.
Okay. It just looked, you didn't see any white patches or?
No.
Okay.
I mean, maybe a little red, but nothing like
Just a little
white
red.
or pussy.
Okay. Okay, for 3 days, you got it. And it's mostly pain right here in your throat. Does it spread anywhere else, the pain?
No.
And so it's scratchy and achy. Is it worse when you swallow?
Yeah.
Okay, worse when you swallow. And so what brought it on? Did you just wake up with it one day, or what other symptoms have you had maybe?
I've just been really tired and exhausted. I feel kind of weak.
Okay.
And I've had a fever.
Oh, okay.
Yeah, I think the highest I took was like 101.
Oh, 101.
So
When was
it's been
that?
Around 101 was
Okay.
last night.
Last night. And have you had a fever all 3 days, or just, would you say?
The last 2 for sure. I'm not sure about the first day. I didn't take my temperature the first day.
Okay. So fever 101 last night. Today you have a temperature of 100.2, so you still have a fever. Have you taken any medications?
I've tried like Dayquil and during the day and NyQuil at night.
Okay.
That doesn't really help all that much.
Does it bring the throat pain down at all?
A little bit.
A little bit.
I still feel it.
And when was your last dose?
Last night I didn't take it this morning.
Okay, so last night. We asked that because it has Tylenol in it and it'll bring down your fever, so I just wanted to know when the last time you said you took it. So, usually people have a sore throat like with a cold, so do you have a runny nose? You do have a runny nose, okay, and did that start with the,
Yeah, and all kind of started with me like, I'd say like a 12-hour period.
okay. What about, does your face hurt? Do you have nasal stuffiness or just runny?
It's mostly just runny.
Runny, and what color is the mucus?
That comes out of my nose?
Yeah.
It's
Blow it.
clear.
Clear, okay. Do you have, a cough?
Yeah.
Okay. Is anything
It's
coming
like
up?
intermittent, but no, it's dry.
It's a dry cough, okay. Is it worse in the morning?
Yeah, a little bit.
Okay. Sometimes when you get postnasal drip, it drips down and can cause that. But so okay, so you have a runny nose, fever, cough, and very sore throat. Is anyone around you sick?
Not at home, but at work. I'm a teacher, and some
okay.
of the staff and some of the students have been sick.
Okay. So your teacher, what do you teach?
English.
English. At a high school or middle school?
High school.
high school, okay. So you're exposed to a lot of different students and stuff, and people at school are sick, okay. And, just so I know, do you live, are you married?
Mm-hmm.
Married, okay, and do you have children at home?
2.
2 kids, how old are they?
15 and 17.
Okay, and they feel well, everyone feels okay?
So far.
Okay, and anyone else living in the home?
Mm.
No, okay. I'm just gonna get an idea of your past medical history so I can help connect this together. Do you have a history of diabetes? Hypertension? Hypercholesterol? High cholesterol? No, any chronic illnesses? Asthma?
No.
No? Okay. Do you take any medications other than your Dayquil and NyQuil? Do you take any daily medications? No. Have you ever taken any daily medications? No, okay. Do you take any herbal remedies, like anything over the counter besides Dayquil and NyQuil? No, okay. And have you ever had any surgeries?
I had my appendix taken out when I was like 22.
Okay, appendectomy. Have you ever had any plastic surgery, anything like that with your eyes, LASIK, anything like that? Okay. And any injuries to your face, your neck, nothing like that? Okay. When was your last period?
About 3 weeks ago.
3 weeks ago. And any chance you could be pregnant?
No.
No?
My husband had a vasectomy.
Husband had a vasectomy, all right.
2 is plenty.
Yeah, 2 is good. Okay, any allergies to medications?
Not that I know of.
Any allergies, environmental allergies like to cats or grass or, no, nothing like that? That makes you sneeze? And any food allergies?
No.
Okay. And when's the last time you went to the doctor?
Probably about 8 months ago.
8 months ago. Did you have a physical? And everything was okay? Yeah. Okay. Up to date on your pap smears? They're normal? Okay. Tell me about your family history, your mom and your dad. Are they alive and well?
My dad passed. My parents divorced when I was young, so I don't really know much about him.
Okay.
One story or anything.
Do you know what he died from?
I don't.
You don't know what he died from, okay. What about your mom?
She's 80, and she's alive. She's well. She doesn't live in the area, so I don't see her very much. But
She has
we talk on the phone.
diabetes, high blood
She's
pressure.
fine.
She's good. No medication. No, okay. Do you have siblings?
No.
No siblings. Okay. Did in the family that you know of any cancers, heart attacks? Very blessed. Okay, and then do you exercise?
I don't go to the gym, but I go for a pretty good walk, like maybe 3 times a week.
Have you been able to exercise since you got sick? Because you just feel too cruddy. Okay. And do you drink any alcohol?
I do.
How much do you drink?
I usually have a couple of drinks at night.
2 a night? What do you drink?
Usually red wine.
Red wine. So 2 glasses a night?
Mm-hmm.
Have you, how many years have you been doing that?
On and off, probably about 10, 15 years.
Okay. All right. Have you ever, with that amount of wine, have you ever felt the need to cut back on it?
No.
No? Okay. Has anyone mentioned you're drinking? Does that annoy you? No? No one's mentioned it? Do you ever feel guilty for drinking?
I don't know. I mean, there are times where I wonder, like, if it's healthy, if I should keep doing that. I mean, they say 1 glass of wine is good for you. I usually have 2.
Yeah.
But I don't know. I mean, I never feel like I'm getting drunk or anything.
Okay.
So.
Okay. Maybe sometimes you just wonder. Okay. And then you don't use it in the morning when you wake up to
Oh, God, no.
Yeah. Okay. We asked those 4 questions. If people answer yes to more than 2, we worry about alcohol dependence. I would try and recommend decreasing to try 1 glass a night. Yeah. Just we don't know the long-term consequences can be for 2 a night can be somewhat valid for you. So I would reduce that. Do you smoke cigarettes?
No.
Have you ever smoked? No. No. Does anyone around you smoke? Your husband smoke?
No.
No? Okay. And do you do any kind of drugs, marijuana, cocaine, speed? What else is out there? What's the new one? Fentanyl?
Bath salts.
All the teams at your work are doing. What? Tide Pods, yeah. And have you traveled recently?
I wish.
No travel. Only in the summer for teachers, right?
Right.
Okay. And lastly, I just want to know, you are having body aches, is that right?
Yeah, it's just like, I can't really pinpoint, it's just like everything feels weak and
You just feel weak and achy. Okay. Have you lost or gained any weight in the last 6 months without trying?
No.
No. Okay, no weight changes. Any night sweats? Have you had trouble with your secretions, like you can't swallow them or you're drooling?
No. I mean, swallowing is kind of hard, but it's just because it hurts.
It's not like you choking on it.
No.
Have you had a change in your voice?
I don't think so.
No. And you don't have any family history or personal history of thyroid problems? No one's had a big thyroid, or no one's ever told you you have a big thyroid? No. Okay. Any headaches?
Mildly.
Just
that's not
mild.
really-
Okay.
It's just 'cause I'm tired.
Any dizziness?
No.
Any chest pains, heart palpitations? No. Difficulty breathing? I know you have a cough, but do you feel short of breath? Like where you're really winded recently?
I mean, I feel like activity makes me a little bit, I mean, it's not like I can't breathe at all, but I feel it, and I usually don't. If I
Okay.
go up a flight of stairs.
Okay. But just since you've been sick the
Yeah.
last 3 days. Okay. Any nausea, vomiting, diarrhea? No? Any swelling to your legs?
I don't think so.
No? Okay. I think what else I want to ask is sore throat. Any uncomfortableness in your abdomen? Like you feel, no? Okay. And have you ever in the past, like maybe when you're in college, had mono, or is this the worst sore throat of your life?
It's pretty bad, yeah.
Pretty
I've
bad?
never had mono or anything.
Okay. Okay. Anything else you want to tell me about your sore throat before I examine you? Okay. Okay. Very good. All right. Well, I guess I'll start my exam if I think of anything else to ask you. I'm just going to start by, sorry.
It's okay.
Any pain to your head?
No.
Is this painful at all here? No. Painful here? No. Good. Okay. I'm going to look in your ears. Does this hurt when I pull in your ear?
No.
Does it hurt when I push in your ear there?
No.
Lovely eardrum, nice and bright. Does it hurt when I pull?
No.
When I push?
No.
Yeah, very good. Okay. I'm also gonna look in your nose if that's okay. Right there. Good, okay. And then I need to grab a tongue depressor. Good, sir. Okay, in your mouth. Can you say ah? I don't want to gag you, but okay, say it again. Mouth here. Can you lift up your tongue? Good. Good. Okay, your lips. All right. I'm gonna look at your eyes real quick here. You noticed your eyes red? Can you look up for me? Good, and then down. Good. Okay, I'm gonna feel the nose around your face. Okay. Any pain? Is it okay if I untie your gown a little?
Sure.
Okay. Thanks. Is this painful back here?
No.
Have you noticed any lumps here above your clavicles? No. Good. Okay. All right. That's good. So eyes, ears, nose, mouth, throat. I'm just gonna feel. Make sure your thyroid's not big. Okay. Can you swallow for me? It hurts, huh? Oh, sorry. Okay. Good. All right. I'm gonna listen to your heart and lungs. Make sure you. Anything going on here? I'll start in the front here. When you feel my stethoscope on your chest, just go ahead and take big breaths in and out, okay? Hang on a second. It's so cheap. Okay. You're not gonna say that for real. else. I'm gonna get under your breast. Do you wanna lift it up yourself, or do you want me to do it? Here, other side actually. Good, okay. Good, okay, other side. Give me the skin here. Good, okay. I'm just gonna lift up under here. Breath. Let's see, sorry. Good, okay, big breath. Good, get all those lobes here. I'm gonna listen to the back. No, maybe you can just, for purposes of showing the students. There we go, perfect, okay. 5 minutes. I won't torture you, don't keep breathing. 2, 3, 3, 4, 4, 5, 6, 7. 5, 6, 7. Okay, all right, very good. Okay, come back around. I'm actually going to feel your belly to make sure you don't have anything. Okay, by your belly. Just going to look real quick at your belly. And you haven't had any nausea, vomiting, or abdominal pain? No? Okay. Or diarrhea? Eating okay? Your appetite been okay?
No, I haven't really had much of an appetite.
Do you follow a special diet at home?
No, I mean, we ate pretty healthy, like lots of vegetables, proteins, not a lot of sugar, salt. But I just haven't been hungry lately. And then it hurts to swallow, so I just not been eating as much as usual.
Okay, I'm gonna have you take a big breath. Okay, another big breath. Good. I'm just feeling for any big liver or spleen. And I don't see anything. Good. Okay. All right. Go ahead and sit up for me. And then hang tight. Cut camera.
Okay.
Okay. So I'll tell you what it says after. Okay. Thank you. These are your findings. Very good. I think that concludes my exam today. Is there anything else you'd like to tell me before I go talk to my preceptor? I see that you do have some swollen nasal mucosa, and it says your throat is not with any white patches, but you do have swollen lymph nodes here. That's what I'm finding, and that you do have some clear discharge. So is there anything else you'd like to tell me before I go talk to my preceptor and we come back and tell you the plan? Can't think of anything. Okay. All right. Well, that concludes my visit, and thank you so much for letting me see you.
Thank you.
Okay.
Yay.
All right. Before I let my actress go, do you have any burning questions for her? Do we need her anymore? Let me think.
Do you really have a bad cough?
I know. No, she's a great actress. She's good, right? She's good. Okay. Let me let her go, and then we'll debrief. Okay.
Thank you.
Okay, so that's the $1 million question. Once you pick out, okay. Let's go through each thing, and I'll tell you what I was thinking. But maybe that would help the most. But this is why you need all this practice, because yes, what do you know how to do a full lung assessment, and what do you pick out to do? So I didn't, because her lungs were clear, and she has no history of anything. So to take all the time to do, symmetric expansion, percussion, palpation, and I just did auscultation. In a real world setting, you wouldn't, with clear lungs and no history, I don't know that other providers might totally disagree, but honestly, you don't see a whole lot of people percussing for for a healthy person with a sore throat.
And why did you request the act?
Because, I asked her if she had, with mono, I was looking for hepatosplenomegaly, and that's my way of checking the liver edge. That's why. So that's where it gets hard, because you've learned how to do a thorough body part assessment. So what do you pick out to do for a focused? That's where it gets hard.
And we're not having to explain during, like, remember when we first did the test to get into the class, we're not having to say what we're looking at the whole time, are we? Or we're just doing it as if it were a real life assessment. We're not going, oh, I've done this or I've done that, narrating as we go, right?
You can say, you tell the patient what you're gonna do.
Okay, but we're
That's
not
what you
saying as if we're narrating it to you.
No, it's kind of hard because we give you a findings card. So like I was looking in her ears and they were perfect, but what if I hand you a card that says her ear is red? So more so we want you to say, okay, I'm gonna touch you, you know, and like I said, does this hurt or does this hurt? I'm gonna look in your ears, I'm gonna look in your nose, that kind of thing. So just more talk to the patient about what you're gonna do. Okay, so I started with the history of the old cart. I probably jumped around a whole lot because I'm not, I like to kind of get to the meat of things first. So I don't know, I probably jumped around a whole lot. I didn't stick to a lot of the scenario. I know I jumped around, but that's my way because I want to know kind of who they are before I start working up a symptom.
What was the connection between the thyroid and a cough?
If you have thyromegaly, it can trigger a cough. Yeah. So that's where also knowing your differentials comes in. So probably, honestly, your big key thing in all those 9 chief complaints is get to know so write down lots of differentials for each one, because one of the differentials was thyromegaly triggering maybe part of the cough, or it can cause sometimes a sore throat. So that's why I was ruling out her thyroid. So for each of the 9 complaints, get to know your differentials so that you know what to ask, because the differentials drive what you're asking. I thought of mono. Mono is typically the worst sore throat of your life. It's typically crowded, living in crowded environment, which is why I wanted to know if anyone else lived with her. And so because I had that as a differential, that drives all your asking in your associated radio systems. That's like the key to health assessment, I think, is knowing your differential so you know what to ask. I don't even know every differential for everything. So that's why it gets hard. You don't know what you don't know. And so that's why knowing red flag differentials is helpful. I asked the trouble with secretions, the drooling, muffled voice, because that's a differential for epiglottitis, peritonsillar abscess. So that drives those questions. The thyroid drove, you know, family history of thyroid, personal history of thyroid. Has anyone ever had a big neck? That drives those questions. And then I did my associated review systems at the end. To me, that makes more sense because you kind of have a picture of who she is. Then are you having, but it doesn't have to be that way. Every provider does things differently, but that to me makes the most sense to ask them at the end, because you kind of get a picture of who they are and can ask questions, but you can put them right after the HPI too, that's fine. And why did I ask about her period? Why did I even care?
I'm gonna put her on.
Yeah, in case I give her antibiotics, I want to know if her husband's had a vasectomy. Am I worried that she's trying to get pregnant, or nope, she's had 2 kids, that's enough. So end of story on that. At 40, she could totally be trying to get pregnant. What if she doesn't have any kids and she wants to get pregnant? Then you would want to look up your pregnancy category of whatever you're giving her to make sure it's safe, just in case. And say, if you're trying to get pregnant, it's up to you if you want to take these. It's generally safe, but you know, this is what's going on. So what else? And then associated were, so what the biggest differentials is like, oh, you know what I forgot? What did I forget? Yeah, I
It
forgot.
sound like you're getting at like the hoarseness and loss of weight. I was like, oh, she's doing all her TB assessments.
Yeah, though, did I ask her if she had a PPD or a flu shot?
No.
Totally forgot that. So that I missed.
Yeah, that's nice sweats though.
I asked night sweats.
Yeah.
Not if everything else was no, because we've had students miss a category, but as long as everything makes sense and the symptoms make, physical makes sense for the history, we don't fail off one missing thing. But that would have been very good if I had asked flu shot.
And that only really matters because she's coming in with possible of respiratory. If it was abdominal issues, you're saying it wouldn't matter if you asked about it.
Right, so one of the differentials would be influenza, and so that is something that would have been very important to ask. Flu shot, you can still get it having the flu shot or not, but with fevers and sore throat, body aches, influenza is a big one. And so viral URI, yes.
So I've gone in for sore throat, and they don't ask me for my family history.
Yeah.
Is that just because of the OSCEs, or would you typically go into family history and do something like that, sore throat or cough or?
We do it very thorough here, so you learn.
Okay.
You'll pick up what you need to do at certain places, and it depends on if you've seen them before you have it in the chart. If you're working urgent care and you think it's associated or related, then you would ask. For this one, because I was worried about her thyromegaly, to me that was appropriate. But does it matter that her mom and dad are alive and well? And I mean, you have to choose if that matters. But we do teach you more on the thorough side, so that you can back it up as you need to.
And do you only ask about mom, dad, or also siblings?
Yeah, mom, dad, siblings, and then, so 1 or 2 generations up, and then lateral too. Yeah, she didn't have any siblings. Yeah, so I forgot my health maintenance, which I wrote down, but I didn't, I wrote just the section, and I asked her when she went to the doctor and everything was fine, but I did not ask her, vaccine, so that would be something that I would then, whoever was debriefing me would say, you did fine, except you forgot to ask these 2 things, and I go, oh. So, as long as, you know, it's a safe, I don't know if that's even, if everything matches up, if it's a concise physical for the history, and, it flows well, and most red flags were obtained, then it's passed, yes.
I mean, like, in clinical practice, maybe I shouldn't ask this. So she works at a school, could you gather that she probably has to be immunized for certain things because she works in a school where that's never staying the same?
You can't assume, because what if she's total anti-vaccine?
Yeah.
Yeah, and some nurses don't wanna get it either, so I have to wear the mask, but,
So always ask all their immunization histories.
well, ones that are, would be appropriate, so I wanna know so much about her tetanus, not so much, I'd wanna know about her flu mostly.
So the health maintenance, what questions should you have asked?
When was her last flu shot and PPD?
You didn't have to ask the travel.
No, no.
Okay.
So that's where these focus get hard.
Okay.
You have to pick out of everything you've learned in this class and how to apply it focused to the chief complaint. And so that's why we look for going down too many rabbit holes. You know, if you take 18 of the 20 minutes, you know, can you tell me your Hep B series as a child? You know what I mean? Like going down those kind of rabbit holes, then no, you know.
Sink trap.
But a general overall history and
Time trap.
yes.
Or no matter what in health it is, so after the, like, cardio and respiratory, correct?
Yes, yes.
So even though we,
Back pain?
like 2 minutes of your, cause you have to do full breath in, full breath out for each of those, what, 18, 16
To be thorough, yes, we've decided for every chief complaint. But that's what I wrote on your OSCE expectations, basic heart and lung. If they're, okay, so they're there for a cough. You're not just gonna listen, then you'll do the inspection, palpation, percussion, auscultation, symmetric expansion, all that, maybe some special voice tests, if you're looking for COPD. So then you would do everything versus just listening. I just listened because, I knew that the finest parts of the lungs were clear, so I just listened. But even with a sore throat and no past medical history, no smoking, I wouldn't necessarily start percussing and, do all the advanced tests, because that's not necessary.
But the basics respiratory is full auscultation.
Yes,
all the-
inspection, I guess I could say, chest diameter was 2 to 1, I could have said that out loud. And auscultation of all the spines. But, like I said, if it's cough, then you're looking at full, and if it's eye, so I only looked at her conjunctivitis sclera. To me, I just wanted to make sure she didn't have a conjunctivitis going on with, what I was thinking was a cold. Conjunctiva and sclera, if she had an eye complaint, would I have done, what if you saw me for this, doing all the 6 cardinal fields of gaze, confrontation, you know what I'm saying? Fundoscopic, Snellen, that's what I'm talking about, a rabbit hole, like, don't go down that, even though we've taught you all of those eye things, those are not appropriate for a sore throat.
Just because you
And
can
that's what you have
doesn't
to
mean
start
you
figuring
should.
out, and that's what these next few weeks of practice will help you, because you'll be doing these scenarios, and then you'll come get myself, Professor Lamb, and say, this is what I did, and then we'll say, what we think best. Yes?
Okay, sorry, I was trying to hate me, but she had a cough. And
Yeah,
But there's a-
you're right about that, I was a little off, but, they were meant to be clear, so. And if you get a findings card and it doesn't have what you think, then just assume it's negative. Like her findings card was just, swollen nasal mucosa, clear nasal GC, and tonsillar lymphadenopathy, so I have to assume the heart and lungs were normal and everything was normal, thyroid was normal. We're not gonna put all the normals. But, if you have, the problem is if you get to your 20 minutes and you give this at the 20th minute, then you have to leave the room. If you have 2 minutes left, you go, is it okay if I check one more thing? We'd rather
I see.
you just can't leave the room and then come back.
Mm-hmm.
You have to kind of think. And it's okay to sit down for a minute. Yes, it's okay if you say to the patient, I'm just gonna go over my notes, I have a few minutes left, let me just make sure I got everything.
Okay.
That is a question.
And how long do we have to write it up?
20 minutes.
And what would you write for your assessment for that?
Pharyngitis.
I'm sorry, can you explain the finding card one more time? So what do you have to be
Pass it around, yeah.
Oh, yeah, it's no,
Wow.
you don't need it after the physical.
At the very
Well, at least there's no plan.
After the physical.
Can you imagine walking in,
Oh,
this physical is
yeah.
over, and she had to.
Who gives it to us?
The extra.
Start.
So she was supposed to have it tucked under her. I forgot to give it to her.
Okay.
Yeah, so
And so do we say I am?
you'll say, oh, I see you out here ready or drop.
Yeah. How does she know when we're done though? How do they know when we're done?
They're,
Are we supposed to say-
they're well trained enough to know.
And this is a cue for us, in case we're going the wrong way, to help redirect.
It's just to guide you on what they
Okay,
have.
So we have a few more.
Yeah.
They're not gonna
You've
give
already
it to you
assessed.
when you have 2 minutes left.
Like they have to know that you're completed what you think you need to do.
Okay.
If you get the card and you're on point, you're like, okay, cool, well, I'll talk to my preceptor and I'll
Yeah.
Or if not, that gives you clues to what maybe you missed or you weren't anticipating, then if you have time, you can go back.
Okay.
If you get that, you miss stuff, you're out of time.
So we have to indicate, or they may know, okay.
And otherwise, the card then is just to help you formulate your assessment?
It gives you your findings.
Yeah, your
What you
findings,
would
right.
really find in this case. So I would suggest, based on what I missed, maybe to write your differentials on this cheat sheet. So I should have put differential of mono, flu, viral URI, and then that would have maybe triggered me to ask that, but, maybe that would be helpful to put your preceptor, and what do you think what are 5 things you think it could be? Go back in with your preceptor, you review it, tweak it, come up with a diagnosis and a plan. That's the first day of clinical, you have to be safe to take a nice history and an appropriate physical. This is the point of this class. And you will be ready. It won't take long to demonstrate. Do you have your labs out?